A fractured or broken bone is a serious injury, but for our purposes, it is the resulting immobility that is the real concern. Proper securing and splinting of a broken bone is an invaluable part of a medical evacuation. Broken bones are, of course, caused by major physical trauma and are a danger of any physical activity. Obvious signs of a fracture or break after trauma include clear physical deformity at the affected site or bone-penetrating skin. Smaller breaks can be confused with a sprain. To differentiate, note that sprains can usually bear weight and present pain in soft muscle tissue, while breaks cannot bear weight and present pain over hard bone. In general, the best treatment for broken bones is to keep the patient still and in place and allow EMS to handle it when they arrive. If, however, EMS is unavailable or the patient must be moved, splinting is appropriate. Splint the break in the position that you found it in. Use something rigid for support, like a SAM splint or even a stick. Place it against the break and try to conform it to the position that you intend to splint in. The goal of the splint is to immobilize the break itself and the joints above and below the break. Each of these sites should be secured to the splint with 2 ties above and below the site, as seen in the pictures. Secure the splint tightly, but not so tight as to impair circulation or sensation. Regularly monitor these things after applying it, and adjust the splint if necessary. Note that secondary risks of broken bones include bleeding, infection in an open fracture, and shock. Make sure to monitor and treat the patient for these conditions.